There's a silent threat that's quietly affecting the hearts, brains, and kidneys of millions of Americans. And the scariest part? Most people don't even know it's happening. High blood pressure, often called the silent killer, doesn't knock on your door. It doesn't always give you a warning sign. But what if I told you your body has been trying to talk to you all along? You see, the symptoms are there. They're subtle, easy to ignore, and sometimes they feel like ordinary aging, like being tired or getting a headache. That's what makes high blood pressure so dangerous. It hides in plain sight. Now, imagine this. Instead of brushing off those moments of dizziness, or that ringing in your ears as just getting older, what if you recognize them for what they really could be? Early warning signs. What if you acted sooner? Because here's the truth. Catching high blood pressure early could save your life. It could prevent a stroke. It could protect your kidneys. It could stop a heart attack before it starts. So today, I want to help you tune into your body clearly, calmly, and maybe even in time. And don't go anywhere, because near the end of this video, I'll share the most overlooked symptom of high blood pressure. It's the one that even many doctors tend to miss. You might think it's harmless. You might have brushed it off for years. But studies now show it could be a crucial early warning sign, one that you need to know about. So, stay with me, because recognizing this one subtle clue might be the difference between catching high blood pressure early or missing your window to act. Let me tell you about Janet. She's 70 years old, and just a few months ago, she started having headaches. Nothing too alarming at first, just a dull, steady pain that wouldn't go away. It lingered for a week. No fever, no cold, no clear reason, just that pounding, unshakable ache. Janet thought maybe it was stress, maybe dehydration. She waited, drank more water, took Tylenol. Still, the pain didn't quit. When she finally went to the doctor, they took her blood pressure. It was 250 over 175. That's not high. That's dangerously high. That's what's called malignant hypertension. And by then, it had already started damaging her kidneys. She now lives with chronic kidney disease. She takes 3 different blood pressure medications every day. Her vision's been affected. Her heart has weakened. And just recently, she had a heart attack. All from something that started with a headache, something she almost ignored. Now, I'm not telling you this to scare you. I'm telling you because Janet's story is not rare. It's far more common than we'd like to believe. Most people with dangerously high blood pressure don't know it, and they don't find out until their organs are already under attack. But here's the thing. This doesn't have to happen. You don't have to wait for your body to fall apart before you take action. Instead of thinking, it's just a little dizziness, or my ears ring sometimes. What if you paused and said, maybe it's time to check my blood pressure? Because the earlier you catch it, the more damage you can prevent. And that's what this video is all about. Giving you the awareness Janet wished she had before it was too late. You might be wondering, if high blood pressure is so dangerous, why doesn't it cause more obvious symptoms? Well, that's exactly what makes it so tricky. It's silent. And when it does whisper, it sounds like things we often brush off. Fatigue, a little dizziness, maybe some ringing in the ears. But behind those subtle signals, real damage could be happening. You see, high blood pressure puts strain on your blood vessels. Over time, that pressure can wear them down. It weakens the walls, narrows the pathways, and makes it harder for blood to reach the places that need it most, like your heart, your brain, and your kidneys. It doesn't happen overnight. It builds quietly until something gives. And when it does, it can lead to strokes, heart attacks, kidney failure, or even cognitive decline. That's right. Long-term high blood pressure has been linked to memory loss and dementia. So the danger isn't always what you feel today. It's what's being built up for tomorrow. Instead of waiting until the damage is done, wouldn't it make more sense to catch these early signs and act on them? That's the goal of this video. Not just to inform, but to help you recognize the signs early enough to make a real difference. Because the truth is, many of these symptoms aren't random. They're warnings. And the more you understand them, the better you can protect your health for today and for the years ahead. Let's take a closer look now at the symptoms your body might be showing. Symptoms that, while easy to ignore, could be signs that your blood pressure is climbing too high. To make things easier, I've grouped these symptoms by the part of the body where you feel them. That way, if something sounds familiar, you can connect the dots more clearly. Group 1. Symptoms in the head and neck. 1. Headaches. Not all headaches are from high blood pressure, but when blood pressure rises quickly and sharply, it can increase the pressure inside your skull. That can cause a throbbing headache, often behind the eyes or at the back of the head. And when it's persistent, like Janet experienced, it can be a sign that something serious is going on inside. 2. Dizziness. Have you ever stood up and felt the room spin a little? Or had moments where your balance just felt off? Dizziness can happen when high blood pressure affects the flow of blood to your brain. It might be mild at first, but when it happens often, it's time to pay attention. 3. Blurred or double vision. The blood vessels in your eyes are delicate. When high blood pressure puts too much force on them, they can become damaged. You might start noticing your vision getting fuzzy, or even seeing double. That's a red flag, because if it's affecting your eyes, it might also be affecting other vital organs. 4. Tinnitus. Ringing in the ears. We'll talk more about this later, but for now, know that high-pitched ringing in your ears isn't always just normal aging. It could be your inner ear reacting to changes in blood pressure. It's more common than most people realize. Group 2. Symptoms in the chest, heart, and lungs. 5. Shortness of breath. High blood pressure makes your heart work harder. Over time, that can cause the heart muscle to thicken, making it less efficient. That may lead to fluid buildup in your lungs, making it harder to breathe, especially during activity or at night. This isn't just getting older. It could be a sign your heart is under strain. 6. Chest pain or discomfort. Your heart needs oxygen to function, and high blood pressure can make it harder for your blood vessels to deliver it. When that happens, you might feel pressure, tightness, or pain in your chest. It's not always a heart attack, but it is always a reason to check your blood pressure and get help. 7. Heart palpitations. That fluttering, pounding, or skipping beat. Sometimes it's just stress or caffeine, but other times it's your heart trying to keep up while working under pressure. If you feel it often, don't ignore it. Now let's move into the rest of the body, where high blood pressure shows up in ways we might not expect. Group 3. Full body and systemic symptoms. 8. Fatigue or confusion. Have you ever felt unusually tired, even after a good night's sleep, or found yourself struggling to focus? forgetting simple things, or feeling mentally foggy. High blood pressure can reduce oxygen delivery to your brain and organs. Over time, this can leave you feeling drained and mentally scattered. Instead of blaming age or stress, consider that your brain might be sending a distress signal. 9. Nausea or vomiting. It may sound strange, but very high blood pressure can trigger parts of the brain that control nausea. This is especially true during a hypertensive crisis. If you're feeling sick to your stomach for no clear reason, and especially if it's paired with a headache or vision changes, it could be more than a stomach bug. 10. Facial flushing. Some people notice their face turning red or feeling warm, especially after drinking alcohol. This reaction, called facial flushing, can be tied to blood pressure changes. While it's not a definite sign of hypertension, it could suggest your body is sensitive to pressure shifts and needs monitoring. 11. Tremors or feeling shaky, or noticing your hands tremble. High blood pressure activates the fight or flight part of your nervous system. That means more adrenaline, more tension, and sometimes visible shaking. It's not just nerves. It could be a sign your body is overstimulated by pressure overload. 12. Nosebleeds. While most nosebleeds aren't caused by high blood pressure, there's a link. When pressure builds up in your blood vessels, especially if they're already fragile, it can lead to sudden bleeding. If your nose bleeds often, and you can't explain why, it might be time to check your numbers. Group 4. Neurological and cognitive symptoms. 13. Numbness or weakness in the limbs. This is one of the most serious symptoms. If you feel sudden numbness or weakness, especially on one side of your body, it could mean high blood pressure has led to a stroke. Don't wait. Don't guess. Call for help immediately. These symptoms don't always mean your blood pressure is dangerously high, but they are your body's way of waving a red flag. And when several of them show up together, that's when it's time to take them seriously. Because the more you understand these warning signs, the better your chances of catching high blood pressure before it leads to something irreversible. Now let's talk about the symptom we promised earlier, the one most people overlook, and even many doctors don't mention when talking about high blood pressure. Tinnitus. That high-pitched ringing or buzzing in your ears. You might hear it when the room gets quiet. You might notice it more at night when you're trying to sleep. And you might think, it's probably just part of getting older. But what if it's not? Studies now suggest that tinnitus may be linked to elevated blood pressure, especially when that pressure affects blood flow to your inner ear. The inner ear relies on tiny, delicate blood vessels. When blood pressure rises, it can strain those vessels, disrupt circulation, and trigger that constant noise you hear. In fact, one major study in Norway found that people with high blood pressure were more likely to experience tinnitus, especially men over 65. And that connection is becoming more widely recognized. But here's the twist. Many people who suffer from tinnitus never check their blood pressure. They try to treat the symptom, not the cause. They switch headphones. They change their diet. They even take supplements. And yet, the ringing continues. Instead of guessing what might help, imagine if your very first step was checking your blood pressure. Just that one action could reveal something your ears have been trying to tell you all along. Now, to be clear, tinnitus can have many causes: noise damage, medications, even stress. But if you've noticed it showing up more often, especially alongside other symptoms like dizziness or headaches, it's worth asking, is this my body waving a red flag? Because the sooner you uncover the real reason behind that ringing, the sooner you can take steps to quiet it and maybe even protect your hearing, your heart, and your brain at the same time. Don't ignore the sound. It could be your body trying to get your attention before it's too late. So let me ask you something. As we've gone through these symptoms, headaches, dizziness, ringing in the ears, chest pressure, numbness, how many of them sound familiar? One or two might not seem like a big deal, but if you're nodding your head to 3, 4, or even more, it's time to pause, because when multiple warning signs show up together, they're often pointing to the same root cause, your blood pressure. It's like your body is speaking louder and louder, hoping you'll finally listen. And instead of brushing each symptom off as isolated or unrelated, what if you stepped back and saw the bigger picture? You might be thinking, but I'm just tired. It's probably nothing. Maybe. But wouldn't it be better to check and know for sure? Instead of hoping it goes away, imagine the peace of mind that comes with clarity, with numbers, with a plan. Because high blood pressure isn't just about a number on a screen. It's about protecting the people you love. It's about being here, healthy, for the moments that matter most. If you've recognized 3 or more of these signs in yourself, or someone you care about, don't wait. A simple home blood pressure check could change everything. And the earlier you act, the more control you have over what happens next. Now, maybe you're already doing the right things. You've changed your diet. You've started walking every day. Maybe you've even lost some weight. You're checking your blood pressure regularly. But somehow, the numbers are still high, and that can feel frustrating. Like you're doing everything right, and nothing is working. You're not alone. Many people, especially those over 60, find themselves in this exact situation. They take their medications, they exercise, they cut the salt, and yet the pressure stays stubbornly high. Why does this happen? Sometimes it's the medication. Some drugs stop being effective over time. Others can cause side effects, like swollen ankles, fatigue, or even ringing in the ears. Other times, it's not what you're doing. It's what's going on underneath. Hidden kidney issues, chronic inflammation, sleep apnea, or simply genetics. Your body may need a different approach. That's why it's important not just to monitor your blood pressure, but to track how your body responds to treatment. Keep a log. Share it with your doctor. Speak up if something feels off. Instead of silently hoping for better readings, have a real conversation about what's not working and why. Because managing high blood pressure isn't just about following a list of tips. It's about adjusting, personalizing, and staying consistent. And most of all, it's about not giving up. Because your efforts are making a difference. Sometimes they just need to be fine-tuned to work even better. If you've made it this far, then you're already doing something powerful. You're paying attention to your health, and that matters. Because high blood pressure doesn't have to take you by surprise. Not if you catch the signs early. Not if you listen to your body when it whispers, before it starts to scream. So here's what I want you to do, starting today. Get a digital blood pressure monitor. Use it at home, once in the morning, and once in the evening. Write down the numbers. Watch for patterns. Don't wait for your next doctor's visit to find out something's wrong. This one small habit can literally save your life. And if this video helped you see your symptoms in a new light, if it made you think differently, even just a little, let me know in the comments by typing the word helpful. That one word means a lot to me. It tells me that these videos are doing what they're meant to do, helping real people like you stay informed, stay safe, and stay ahead of preventable problems. Also, if you haven't yet, go ahead and hit that subscribe button. There's more coming. In the next video, we'll dive into how to choose the right medication and lifestyle strategies, especially for older adults dealing with stubborn high blood pressure. So stay tuned, stay aware, and most of all, stay well. I'll see you in the next one.